Hello. Now we begin the next section, de-escalation strategies. This happens when prevention ultimately fails and the person ends up off task. The goal of de-escalation strategies is to move the person back to stable functioning. Now let me take a moment to caution you against the overuse of de-escalation strategies. De-escalation strategies are great, but if you find that you're constantly moving somebody from off task back to task, that lets you know that there's likely a more systemic problem going on that you need to address. You should talk to your supervisor about. Keep in mind that being off task is a precursor for more severe crisis behavior and should be treated as such. This is a lower version of problem behavior. So it's important that at this time, this problem behavior is not met with reinforcement. And you use the alternative measures to prompt appropriate behavior and bring the person back to stable functioning. The goal here is to return to stable functioning as quick as possible, but make sure that that doesn't necessarily require reinforcement of problem behavior, because otherwise what you're going to do then is end up reinforcing problem behavior that will eventually get worse to crisis that won't be able to be avoided. We'll talk about some strategies on how to do that. Similarly to those categories we talked about in prevention strategies, they're the same categories of biological considerations in de-escalation strategies. You'll see those here. We'll get into those in more detail in the following slides. The first is biological considerations. These can be health and physical related, they can be arousal related, and they can also be language or developmentally related. Now the goal of de-escalation strategies is to solve the problem that's got them off task and return them to stable functioning. Now, in the area of health considerations, you can see the examples here. Perhaps the individual has missed breakfast. I think all of us have been in a place where we weren't able to eat, and that can be distracting during work. In this case, a de-escalation strategy may be to feed them. Get them something to eat. That doesn't have to be something that they wait for, especially if it's something that will allow them to mediate some of that physical responding that they have, that feeling of hunger, their stomach rumbling, so that way they can concentrate. Similarly, arousal considerations, if the place you're in is loud or noisy or smelly, feel free to move to a place that is more therapeutic and conducive for positive work getting done. However, ultimately you're going to run into the problem where you're not able to solve the problem, such as you're in a workspace that you can't leave, or the person might be hungry but you're not able to provide them with any food due to maybe some medical considerations. Now in that case, behavior may increase to crisis, and there may not be anything you can necessarily do about that. It's during these situations where we prompt those replacement behaviors that we were working on in stable functioning, such as deep breathing or making choices of alternatives. Now this won't work all the time, but with a focus on positive prevention strategies, you should have built them a number of skills up until this point, of which one of them is likely to work. Similarly, when you're dealing with sensory or physical limitations, or those caused by medications that they may be taking, or a health condition or disease. The goal of de-escalation strategies is to solve the problem. If the person is not feeling well, what can we do about it? If we're not able to do anything about it, this is where we may decrease demands. Say, I can see that you're not feeling well. Let's come back to this later. Or, you know what, we don't have to finish that right now. And recover later. This is an excellent way for you to show the individual empathy. Understanding from one human being to another that sometimes you don't feel well. And during those times, demands can be overly aversive, and you want to avoid them. And acknowledging that and allowing them to escape situations when they can't control it can go a long way in building an appropriate relationship. Similarly, within a setting, you're likely to run into situations where the setting you're working in isn't always ideal. And like we talked about before, the goal of de-escalation strategies is to identify the problem and solve it so that that way work can resume. Now, one of the crisis management strategies that PCM teaches is transportation. And that's based off the idea that sometimes the environment that you're in is not conducive or dangerous. And so moving the person is the best option. This is similarly true in de-escalation, except in this case, we may not be physically helping or escorting. It may be as simple as asking the person, you know what, it's too loud in here, let's get out of here. Or, why don't we go and do this in the backyard? If the problem is indeed the place, the person is likely to comply, wanting to leave that place as much as you. And then you're able to reinforce the behavior appropriately and get back to productive activity. Here's some examples to consider. The same can be true with the persons who are in that environment, or the proximity of yourself or other persons in the environment. All of which can be either reinforcers or punishers for appropriate engagement. So you're going to have to figure that out on your own and establish a treatment setting that is most conducive to remaining in stable functioning, most of which should be outlined in the behavior plan. If it's not, be sure to ask your supervisor about that. Another setting strategy is body language. As we talked about in preventative strategies, a large portion of what you're communicating isn't coming out through your mouth. It has to do with the way you hold your body and the way that you stand in relation to the person that you're working on. Within de-escalation strategies, the supportive posture becomes even more important because the person may be agitated and is already off task. Adopting an assertive or aggressive posture may prompt crisis behavior. Now, in the beginning, you may find that keeping a supportive posture is difficult. Sometimes it's hard to keep yourself from reacting to problem behavior. and maintaining that supportive posture. However, I encourage you to not worry and understand that this is a learning process for you as well. This is not something that you're likely to just be good at right away. This is something that through practice you'll get better and better at. So keep working. Next, organization considerations and strategies. Let me start off by saying that this is something you're likely to see addressed in the behavior plan. And if it's not, this is something you should definitely talk to your supervisor about. Because as someone running a session, we should not be making schedule changes on the fly. This can be dangerous to treatment integrity and potentially result in a crisis behavior as a result of changing the typical routine, which many individuals with developmental disabilities have difficulty with. However, given your relationship with the person, it is possible to modify to minimize crisis and increase productivity, as long as you keep in mind that modifications for the schedule or curriculum should not be made just to minimize crisis, but also to increase in productivity. Otherwise, we go back to just putting out fires, but not actually getting anything done. And this is a slippery slope that we want to avoid. Now let's talk a little bit about downtime. We spoke a little bit about this as well during preventative strategies. There are two basic types of downtime: unscheduled and scheduled. Now, unscheduled downtime may occur for a number of different reasons. Now, when this happens, this can be addressed in a number of different ways. Oftentimes, programs or activities can be repeated. This can be used to fill unprogrammed time. Or impromptu scheduling an activity. If the person has done well that day, you may impromptu schedule a fun or leisure activity to show them the result of having a good and productive day is more time spent with you having fun. However, sometimes unplanned downtime can occur due to environmental issues, family scheduling, or lack of materials. In this case, you can always resort back to previously completed tasks, leisure activities, or be creative. Create some new materials. During de-escalation, this is the time where we try to help the person get their eyes back on the prize. Prompting and reminding of rules and clarification of goals may be something that may be too difficult for some of our younger learners. As such, we may utilize procedures such as first then. Well, first we have to do this and then we can do what you want. Or, come on, first we need to finish this and then we can go play. This allows us to quickly remind them of the rules that first program activities need to be done and then rewards or preferred activities can be done. Here's an example. However, this example is geared to maybe a more high-functioning individual. Now let's talk about motivation strategies. During pre-crisis, the individual is off task, which in most cases signals a lack of motivation. So, as a treatment professional, our job is to reconnect them with those reinforcers. And we do that by shaping appropriate responding. This may involve creating opportunities for reinforcement of target behavior, or capitalizing on ones that already exist. You can see in the first bullet point here, they mention waiting for a break in between problem behaviors. So maybe if they're crying and yelling that they're upset, they take a minute to take a deep breath, and then you can prompt or reinforce rather that appropriate responding. Thank you for sitting quietly, taking a deep breath, and calming yourself down. Let's remember what we're working for. During these times, it's important that you actively reinforce any appropriate behavior, so that way we can shape and reinforce that behavior to occur more and more and bring them back to stable functioning. You can see at the bottom of this slide, they even give an example of how you might use the pivot praise in order to reinforce someone else who's engaging in appropriate behavior if you're not able to capitalize on any opportunities with your individual themselves. This can be also very handy if you have a confederate, another staff, or a sibling or parent who's helping out with session. Then they can model the correct behavior and receive praise or reinforcement, prompting your learner to do the same. Similarly, with the use of edibles, points, and other types of motivational systems, we find that when an individual is off task, this is a signal that motivation is lacking in some way. Because when the activity itself is the reinforcer, we don't tend to see off-task behavior. Similarly, for those of you who, which I assume will be most, like working with others and love this job, that's why you're here. And so things like how much you get paid are important, but don't determine whether or not you're engaged with your work. Similarly, with any type of reinforcement, there is some specific criteria that we need to consider, such as size, immediacy, variety, and schedule. In most cases, the person is off task, which tells you that the size of the reinforcer is not big enough, or it's not happening soon enough. Individuals are signaling to you that they want reinforcement in the form of escape, maybe. Maybe the activity is aversive and they want to make it stop. So this is where you can prompt appropriate behaviors for them to be able to access that reinforcer, such as asking for a break or asking for help, so that way the two of you can get it done quicker. They may also be trying to access a preferred activity or item. They want it now. And you may be able to prompt appropriate communication strategies like, I want to go outside. And depending on where you're at in the activity, it may be okay to reinforce that behavior by saying, you know what, thank you for asking, we can do this later. Or you can say, great, let's finish this real quick, then we can go outside. All setting the occasion for appropriate responding and reinforcement of those good targeted behaviors. Active listening is also important during pre-crisis, using your de-escalation strategies. This offers you an opportunity to reiterate what you're hearing from them. I tend to use the template, what I hear you saying is, and then repeat my understanding of what they're asking for or saying. Now, individuals who maybe don't have vocal verbal behavior and don't talk and aren't able to communicate, in this case, I would try to anticipate their situation and then prompt the appropriate response. During this process, it's important to be patient, not try to rush the interaction. Acknowledging feelings if necessary. I understand that you're frustrated, or this is upset. I'm sorry, you're upset. We're going to work through this. Here's some examples. Now, you may allow the individual to vent. I don't always find that this is the appropriate time to do that. Usually I'll do that once the activity is completed. But allow your relationship and your knowledge of the individual to guide you on this. There's also other number of things that you can do to actively communicate appropriately. But keep in mind that during this time, the attention that you're giving is providing attention and potentially escape from task. And if that's what the person is looking for, you want to use that sparingly. You don't want a conversation regarding the difficulty or aversiveness of the task to allow break from the task. The focus instead should be on, if this is hard, this sucks, let's get it done so that way it can be over, if it's a mandatory task. If it's an optional task, it presents a great opportunity for the person to engage in alternative appropriate behaviors, such as requesting for it to happen at a different time, or requesting for the activity to end altogether. If this is a skill that you're trying to build up in your learner, you may even prompt aversive activities just so the person can say, you know what, I don't want to do this. And you can say, you know what, neither do I. Let's not do it. Thanks for using your words and being appropriate. Now, sometimes the communication you'll get from the other person is not helpful at all. And it may take the form of name-calling, profanity, gesturing, or threats. We call these inconsequential verbal assaults. Here's some examples. You're an idiot. I'm going to get you fired. I hate you. Leave me alone. You suck. During these times, it's important that we don't allow this to get us off track. And we use what PCM calls non-reactive responses. Here's some examples. You'll notice that the non-reactive responses acknowledge that the person is indeed speaking and acknowledge the response, but don't touch on the content of the response. So if the person says, I'm going to get you fired, and you say, okay. The reason that we use this is that way that we don't prompt an extinction response, right? Because, for instance, if we were to ignore the response, the person might do what? They might get louder. They may repeat it. They may engage in other behaviors, such as swinging their hands or banging on things. Providing that non-reactive response provides a consequence to their behavior. It lets them know that you heard them. But it doesn't create an opportunity for a dialogue or a continued response chain on the content that they said. So, what should a practitioner like yourself do to de-escalate an inconsequential verbal assault? The answer? Use a non-reactive response. If you're following along in your study guide questions, you'll notice that this is one of your answers. So go ahead and write this in. Another useful technique in pre-crisis is setting limits. This is important because when individuals are off task and engaging in precursor to crisis behaviors, it's important to remind them of appropriate behavior to try to keep them regulated within that area and prompt those appropriate behaviors so that way they can get what they want without resorting to crisis behaviors. Here are some ways you can do this. You can calmly explain or identify what the person is doing that's inappropriate, indicate the problem with that, then provide choices in what they can do instead, and then provide effective reinforcers for those appropriate behaviors. An example of this may be, I understand that this activity is difficult and you don't want to do it. I don't want to do it either. However, it's not okay for you to hit yourself when you're frustrated. Instead, you can ask for help. Let me know. I don't want to do this anymore. Another technique you can use is problem solving. Now, depending on the skills of your individual, you may be the one using the problem solving, or if they have upper level skills, you may be prompting them to use problem solving skills. But keep in mind, problem solving is indeed a skill, which many people don't have, even some typically functioning adults. So, some important aspects of problem solving is to be simple, clear, and concise. Making the situation overly complex makes it difficult to find an appropriate solution. Identifying the problem and then providing choices for an alternative behavior is a great way to problem solve. So for instance, hey, I know you wanted to play on your iPad, but unfortunately it's not charged. So instead we can watch TV or go play outside. And this ends the de-escalation strategies section. Now we will move into post-crisis strategies. Post-crisis strategies. Post-crisis identifies the beginning of return to stable functioning after the conclusion of a crisis behavior. You may remember from your Appendix G, when we went over in Chapter 3, that post-crisis is when the individual is back on task and no longer exhibiting crisis behavior. Similarly to the preventative and de-escalation strategies, biological considerations are important. However, what's different about post-crisis than in our previous two sections is post-crisis follows a significant crisis event in which the person became continuously aggressive, self-injurious, or engaged in high magnitude disruption. This likely resulted in an adrenaline spike and an elevated level of biological processes that, based on their individual situation, may leave them in a tired or maybe even injured state. So it's important that the first thing we do is check on them physically. Check for injuries and provide medical attention if necessary. This may also be a great time to do a body check. so that that way any injuries that were sustained can be documented appropriately, so that that way they are appropriately tended to and not confused as occurring some other time if multiple crisis behaviors happen in the same day. After that, we attend to the individual's arousal levels. We do our best to keep them calm, as well as modeling calm behavior ourselves. So that way we can avoid an unnecessary return to an elevated state. And we can do this through sensory interactions. And this moves us into setting characteristics. During post-crisis, we really want to set the environment up for success. And that means we want to promote and maintain calm behavior, as well as active engagement. Now this may, during a crisis behavior, things may have gotten scattered around or broken. Now would be the time to restore the environment to a therapeutic condition, removing any broken items or putting things back where they came from. This is a great opportunity for the individual to show that they are back on task by helping you with this and making restitutions for any things that were thrown or broken. This also may be a great opportunity for you to take a break yourself and switch out staff or individuals working in the situation so that that way you can get cleaned up, calm yourself down, and be ready to re-engage in an appropriate and professional manner. It's important that you understand that sometimes you're going to need breaks as well. And pushing through and not taking care of yourself is not appropriate. We all need breaks from time to time, and failing to acknowledge and take those breaks can result in burnout. Lastly, proximity. This refers back to our body language and supportive posture. After an individual has had a difficult interaction, they may feel like they may look for additional closeness from you, maybe hugging, crying, saying they're sorry, or they may just need some space in order to reacclimate themselves to the environment. It's important that you understand your individual's client's needs and respond appropriately to avoid a re-escalation into crisis. Now, after a significant crisis has occurred, the person may be in a difficult place because after such behavior, reinforcers or rewards are likely limited. And as with individuals that I've worked in the past, maybe engaging in a serious crisis behavior loses them their big reward for the day. And this can really torpedo their motivation for engagement for the rest of the session or day. During these times, it's important to let them know that other rewards are still available and all is not lost. And as the one helping them, you're going to want to focus on building that behavioral momentum gradually and bringing them back to a place where they feel motivated and ready to earn additional reinforcers. Or you may say, get their eyes back on the prize. Sometimes the easiest way to do this is to pick easy activities for them to complete, or as I'd like to call, low-hanging fruit. Pick what's easy, reinforce them for it, build on that. They've already had a difficult crisis behavior. Now's the time to show them that all is not lost and they can recover. So, to recap, how should a practitioner reintroduce social praise and other activities during pre-crisis? And the answer is by using low magnitude or subtle low-key forms of these variables. If you're following along in your study guide question, you'll notice this is another one of your answers. So go ahead and fill that in. Alright, let's move on to our last and final strategy for post-crisis, which is problem solving and debriefing. After a significant crisis behavior has occurred, it's important that we problem solve or debrief. Now, this doesn't mean talk to the person at length about what they did, how it was wrong, and how we're going to fix it in the future. This has to be mostly just a relatively short conversation where we indicate this is what happened, this is what the consequence is going to be, and then focus on moving forward. Example of this may be, I understand that you were upset and didn't want to do something. However, hitting me and breaking your window is not appropriate. As a result, these are what the consequences are going to be. You're not going to have access to your iPad for 3 days. But you'll still have access to your books, to playing basketball outside and the trampoline. Now, I understand that that's going to be tough, but we're going to work through it together. Keep in mind that once a significant crisis has occurred and you're debriefing, they're likely to be upset about the consequences of their actions. This is natural and to be expected. However, your job is to make sure that you follow through with the consequences. In the situation where a behavior plan or program consequences were already in place, it's important that you don't deviate from those. On the same token, if consequences were not in place, now's not the time for you to create some because the person needs to learn a lesson. It's important that the individual understand that you're somebody who will follow the expectations. And if there was a behavior plan in place that says if this happens, then this will happen, they need to know that you'll follow through. And that you won't negotiate consequences after the event. Because then that limits the punishing value of the consequences and makes it more likely that they may engage in those types of behaviors in the future if they're able to negotiate the consequence. For instance, if I get pulled over for speeding and I'm able to talk the cop into giving me a warning instead of a ticket, then that's not going to decrease the likelihood of me speeding in the future, just my efforts at negotiating. Now, punishing consequences can be difficult for us all. So it's important that you remind the person that all is not lost and help them focus on the next ability they have to access rewards, rather than what they lost out on. Now, after these serious problem behaviors, individuals may experience strong emotional responses. But don't worry if they're mad at you or if they don't like you. This will pass. As long as you continue to follow the treatment plan and pair yourself with reinforcers, they will come to understand that that type of behavior is not okay, but that's not going to affect the way that you treat them. You are still going to follow a predictable plan, and if they do so as well, they will have plentiful access to those rewards that you're able to provide. Because research shows that people tend to like those who are consistent and predictable, not necessarily the ones that give them everything that they want. It's important to know where we stand and that boundaries will be upheld. Going back to the example I used before, if you're able to run a red light or a stop sign without consequences, then the law that you shouldn't do that loses a good amount of its value. Now, the reason for not doing that, because of the immediate danger of getting into a car accident, still applies. But I think as drivers we can all agree that that danger is not always in place. After all, if you roll up to a four-way intersection with a stop sign and there's nobody in any of the other directions, it's clear that the only reason that you would stop is following with the rules. However, it's important that we connect the reason we follow rules to the reinforcers or punishers that they provide. Successful use of these strategies creates long-lasting behavioral patterns and use of appropriate behaviors that will make pre-crisis and crisis behaviors ineffective and eventually stop occurring. During these times, you will be solidifying your personal relationship with the individual, showing them that crisis behavior is not the end of the world. It's just another day and another obstacle that can be overcome. And focusing on positive, appropriate behavior is a much more efficient way to get them what they want. And then you'll be able to resume stable functioning and increasing their overall skills and abilities. This concludes Section 7, Non-Physical Strategies. Thank you.